And we've already looked at the examples of the teratogens. So take notice of retinoids. Retinoids are vitamin A. And you know that a lot of the time, first trimester, the person may not even know that. So some of these things, you have to take note of them. So maternal changes in pregnancy. So I was talking about the fact that when you want to prescribe medication for a pregnant woman, you need to ask yourself that what is the effect of this medication on the pregnancy? And then what is the effect of the pregnancy on this medication? So this is looking at some of the things that occur in pregnancy that can affect the medication in the body. So the first thing is that there's increased volume of distribution. There's increased blood volume during pregnancy. Then there's decreased protein binding. So medications that are bound to protein will not have a lot of protein available for binding. There will be very little albumin. So a lot of this drug will be free in circulation. Then there's also increased hepatic metabolism and increased renal clearance because the mother has to have a more efficient way of excreting toxins quickly. And so if you give medication and the medication is cleared by the kidney because of the increased renal clearance, it may not be as effective as it will be when given to somebody who is not pregnant. So there are some fetal effects of some medications in later pregnancy. So for example, when you give tetracycline to a pregnant woman later in the pregnancy, it causes discoloration of the teeth. Even though the baby is not born with teeth, when the teeth start coming, they will look discolored because of the effect of the tetracycline on the mother. Then warfarin can cause fetal brain hemorrhage when taken in the latter part of pregnancy. Then maternal opioids can cause drug withdrawal or respiratory depression in the neonate. So an example is pethidine. So if it's given in the latter part of pregnancy, the fetus can be born with either drug withdrawal or respiratory depression. A mother who is on antithyroid drugs would give birth to a fetus who may have neonatal hypothyroidism. So I just put a few safe drugs in pregnancy because definitely it isn't all the time that the pregnancy goes smooth without any problems. So if you must prescribe, at least know the medications that are safe in pregnancy. And these are just a few of them. So paracetamol is one, penicillin is another, cephalosporin, so like ceftriaxone, cefuroxime, they are all very safe in pregnancy. Antacids, a lot of the time you have heartburn because of the gravid uterus, and then steroids. So pregnant women who have asthma can safely be given prednisolone without any problems, as well as nebulization with bronchodilators. So drugs in breastfeeding women, most commonly the drugs are safe for breastfed babies because the dosage that goes into the breast milk is very small compared to the actual dosage that the woman is taking. However, some drugs are contraindicated during breastfeeding, and these include anti-cancer drugs, lithium, oral retinoids, and the vitamin A capsules that are used to treat acne, iodine, amiodarone, and gold salts. And so it's important to understand the principles underlying the transfer of the medication to the breast milk. It's also important to be aware of the potential adverse effects on the infant. So the fact is that it's very little. Oh, I want to do yeah. It's very important to be aware of some of the side effects that can occur. Where do you get the bottle? So the factors influencing the risk of adverse effects to the baby include the timing of the dose. So if the mother is breastfeeding, you can advise her that she should breastfeed the child before she takes the medication. At least that will decrease the amount of medication that goes to the baby. because by the time the medication is metabolized, then if the baby is, let's say, fed every 2 hours, you feed the baby and then you take the medication. By 2 hours time or 3 hours time, you breastfeed the baby. Some of the drug would have been out of the system by that time. Then also the toxicity. So depend if you give a certain medication, a certain dose, you can give the least amount that is required to give you the effect so that the risk of toxicity to the baby will be reduced. Then oral bioavailability. So let's say you are giving a medication to the breastfeeding woman. Now, this medication is not well absorbed through the GIT. So even if you give the medication IV, it goes into the bloodstream, it's excreted in the breast milk. The baby takes the breast milk into their oral cavity and into their GIT. Because the drug is poorly absorbed from the GIT, it will not really cause any systemic effects on this baby. And it's also important to look at the relative infant dose, which is always 10% of the mother's dosage. And so once you know this, that is 10%, if you are giving, so let me give an example. So gentamicin. Gentamicin is a medication that is given to both adults and children. So if you are giving the mother 80 milligrams of gentamicin, the relative infant dose is 10% of the adult dose. So that would be 8 milligrams. And if you look at how much gentamicin we give to a newborn, it's 5 milligrams per kilogram body weight. So that means that if this baby weighs 3 kg, then the amount of gentamicin that is safe for this baby is the 3 kg times 5. That will be 15. So you realize that this 15 is the 8 milligram from the mother is far lower than the 15. So it's still within the relative infant dose. Then it's important to consider the age of the infant. So let's say if you have a newborn, the risk of toxicity to the newborn is less, is more, sorry, compared to toxicity to an older child, like a 6-month-old. Also, the frequency of breastfeeding is more in the newborn. So the chance that the drug that is being given to the mother will affect the baby is high, compared to a 1-year-old who is eating banku and everything and just breastfeeds occasionally. So all these things are important factors when you're prescribing to a woman who is breastfeeding. So it's important to observe a few things when prescribing for breastfeeding women. So prescribe the medication at the lowest effective dose. Temporarily suspend breastfeeding and express milk for potentially toxic drugs, such as cytotoxic drugs and radiopharmaceuticals. Then the half-life of the drug will determine when you reinstate the drugs. 1 hour. So you know that in 2 half-lives, which is 2 hours, the medication will be completely cleared from the system. So that is when you can decide to resume breastfeeding. So if, let's say, you are given a medication which has a longer half-life and the drug is very toxic, then you may even need to advise the mother to stop breastfeeding. Then it's also important to select alternative routes to minimize systemic exposure to the child. Choose drugs with short half-life rather than the long half-life, because you know that the shorter the half-life, the quicker the drug is cleared from the system. Then advise the mother to feed the infant before taking her medicine so that the drug concentration in the milk will be at its lowest. And then she needs to understand that it's not as if when she gives the drug will stay in the breast milk and keep increasing. No, it doesn't do that. The need for these drugs should be reassessed, especially in the neonatal period. So as you are giving the mother the medication, you are reassessing. If it gets to a point and you think the mother doesn't need the medication anymore, you have to stop. drug-drug interactions. So drug-drug interactions occur when one drug interferes with the pharmacological activity of the other. And these interactions can result in decreased effectiveness or increased toxicity. Additionally, they may also lead to the development of adverse drug reactions, morbidity, hospitalizations, and death. But it's important to know that only a small proportion of interactions lead to all these things, but they are important because they are often predictable. So, for example, you know that when you are taking this medication, you shouldn't take this additionally, because then it will lead to negative effects. The frequency of the drug-drug interaction is related to the age of the patient and polypharmacy. Polypharmacy means prescribing so many medications to the patient. By all means, one or two of them would interact and give problems. So as the number of the medication taken by the patient increases, the risk of drug interactions increases. For example, it increases to 6% when you are taking 2 drugs, to 50% when taking 5 drugs, and 100% when taking 10 drugs. And even though it occurs in normal drug therapy, there's variation in the clinical significance of the interactions. So some of them are potentially harmful and can occur in a few patients. So there are classifications: major, moderate, or minor. So contraindicated means that it's an absolute no-no. Major means there's a risk of death if there is no medical intervention. Moderate is that there's a deterioration in the patient's condition. And then minor, little effects that occur with the drug interaction. Okay, so we'll close with drug overdose. So a drug overdose is an injection or application of a drug or other substance in quantities that are greater than are recommended. And it is used for cases when a risk to health will potentially result. An overdose may result in a toxic state or even death of the patient. And overdose represents a pathologic level of drug toxicity at such a point that it alters the normal physiological functioning of the patient. And so depending on what drug is taken, the symptoms of the overdose would vary. And it's not always easy to know which is an overdose and which is a sign of an illness. So some of the manifestations are deviation from normal body temperature. So either the temperature will be very high or it's very low. Patients passing out. For example, the patient who takes an overdose of an antihypertensive drug may just pass out, become unresponsive, and lose consciousness. There might be skin color changes. There might be abnormal breathing. The pulse might be fast, it might be slow or irregular. So some of the common symptoms: you have chest pain, seizures, severe headache, difficulty breathing, delirium, extreme agitation or anxiety. So yeah, I think I have to rearrange it. Sorry. Okay, any questions? Please, are there any questions?
Hello, madam. Good evening.
Yeah, are there any questions?
Yeah, please. With regard to missing the dosage, as you gave example regarding the digestion.
With regard to
the case scenario you talk about in the ethics, where the dosage was given more than what is prescribed. Yeah. With that, is it not advisable to avoid using decimal points in those drug prescriptions?
Yeah. In fact, that should have been part of the prescription writing. Okay. So now what is advised is that you convert it to the appropriate unit. Okay. So instead of, say, writing 0.5 milligrams of let's say midazolam, we would prefer you to convert it to micrograms and write 500 micrograms of midazolam. Okay. So that you eliminate the decimal point. Thank you for that point. I will include it. I'll edit it and include it, and then before I send it to you. Any other questions?
All right, thank you.
Yeah, Dr. Maria.
Yes.
Yeah, please. My question is: some women
also unnecessary.
Hello.
Yes.
Hello.
Please go ahead.
Please, some women, when they are pregnant, the first trimester, some room, and you meet a woman in her first trimester, and she doesn't even know she's pregnant, but you gave a drug that you were not supposed to give, and later you realize that. What do you do?
So, well, a friend of mine is he will always do a pregnancy test for every woman in the reproductive age before prescribing. But okay, so here's the situation. You've already prescribed the medication. You can't really do much. You just have to wait till so there's something we call all or none when it comes to teratogens. If you give the medication in the first trimester, distraction and so many problems, or it doesn't do anything, you will never know until the baby is born. So you just have to monitor this person, and at 20 weeks they can do an anomaly scan to see whether there has been any problem with this baby or not. But you can't do much to reverse it.
Thank you, Doc.
All right. Is there any other questions?
Hello, Doc.
Yes,
Please,
Mabel.
I want to know if you have a child who is unconscious and you have to give the medication, you don't know the weight. How are you going to give it?
So you use the age of the child.
Okay. Okay.
So you can estimate the weight per the age of the child. Like the example I gave, you have a 3-year-old. You know that an average 1-year-old weighs 10 kilograms. So 2 years is, you add 2 kilos to it, that's 12 years, 12 kilograms. Then when they get to 3 years, they add another 2 kilos. So that makes it an estimated weight of 14. So you can use the estimated weight. When the child gains consciousness, then you recheck and you can adjust your doses appropriately. Any others?
Thank you, Doc.
All right. Are we all okay? Okay, so I'll do the editing of the notes and then I'll try and send it to Nick as soon as possible. I'm marking your script, so hopefully by the end of the week, the results will be uploaded. But I'm surprised you did so well in the pharmacology, and yes, you were complaining. What kind of people are you? Huh? I just have 10 papers to mark, and you people have done well. It was difficult. Oh, Elisha, send you now to our sweaters. What's that? The so make your name. Yeah, paper for me.
Madam, why from Teco? Don't mind him.
Hey, Madam, well,
I am pharmacy technician. Pa.
Madam, well,
is it not true? Oh.
Anyway, okay. So if there are no more questions, let me go and attend to Akusi. I'll see me feeding.
Doctor, please, for how long are we going to have this class?
So we'll finish.
No estimation.
Small should also be
In my estimation, okay,
Yeah.
so should we do it once a week? Is that
Maybe twice.
too much? Pardon?
Maybe twice we'll do. We'll discuss on our page.
Okay, all right. Okay, have a good night. I'll go through the course outline and then give an estimated timeline.
Yes, Doc. Thank you.
All right, good night.
Good night, madam.
Good night.